Hello and welcome back to our career speaker event for the Early Stage Researchers Working Group in OHDSI. We are really excited to have Dr. Jennifer Lane for our October event. She is a NIHR Academic Clinical Lecturer and a trauma and orthopedic surgeon at Bart's Bone and Joint Health. And she's really excited to be talking today about her journey into both medicine and research and how she got involved in surgery and some of the work and other projects that she's took on during her journey. So thank you so much for joining us today, Jenny. Hi, Jenny. Thanks for joining me today. I'm excited to talk to you about your journey into being a physician and a researcher, and I think a lot of people in OHDSI are going to learn from this as well. I know I am definitely interested in medicine, but I think I am curious to know what being on the academic side is like as well. So I guess maybe you can just start by talking a little bit about what your career is and where you currently work and how you got started. I think hopefully listeners will know about that.
Okay, so currently I'm an NIHR Academic Clinical Lecturer in London at Bart's Bone and Joint Health, which is based at Bart's and the London Medical School in East London. That's a recent post that I took up in September to enable me to have greater academic time in my residency programme. So I originally went to medical school in Oxford back in 2004. Obviously in the UK we do medical school as an undergraduate programme, and in Oxford it's 6 years because there's an integrated bachelor's at year 3. So your first 3 years are very, very non-clinical. We went into labs, we wrote essays, kind of very much about the science of medicine. And then your final 3 years are where you go into the hospitals, you learn your clinical rotations, and then at the end of that 6 years, you're qualified. And at that stage, I left Oxford and I went to do my basic surgical training in London. So the equivalent, I suppose, for you guys is kind of being an intern. We have 2 years of internship in the UK, and that's all generic for everyone, but you can try and choose rotations that you think will suit you. So I knew at that point I wanted to be a surgeon, so I did intensive care medicine, I did general surgery, plastic surgery and orthopedics, as well as a little bit of general medicine, because everyone has to do a bit of medicine and a bit of surgery as part of your internship in the UK. At that point, you then choose what subspecialty you want to go into. And bear in mind, at this point, I'm just a full clinician, as in my intern year, you can get academic programs in internship. So we call that the foundation program. So some people spend a period of time doing academic work alongside their clinical work. But for me, I was just a full-time clinician. And then I went into, I suppose the equivalent would be a junior residency program where we do more surgical training, and we call it basic surgical training. And again, I was full-time clinical at that point. But alongside my clinical work, I think in part because I've always been curious about it, and in part because my medical school training was very sciencey, I was always thinking about the questions that I saw in my patients, and I wanted to think about how could we improve stuff, or I've got that question, can we find an answer to why that person had a worse outcome than somebody else, for example?
Yeah.
And then for us in surgery, at that point, we then go for a 6-year program in your subspecialty area, which I suppose is the equivalent of your residency program. And at that stage, I was awarded an academic residency program place. So our equivalent of NIH is NIHR, National Institute of Health and Social Care Research, and they fund some clinicians to be a little bit academic through their training. So for the first 3 years of my residency, I had 25% of my time I was doing research, and then the other periods of time I was a normal resident doing everything that everyone else was. And that's kind of tough, and we can touch on it because you're trying to balance everything, because I had to meet all of the requirements that someone who was doing 100% was, but in 75% of the time. So I needed to do just as many surgeries, just as many assessments as everybody else, but I had a quarter of the time. Sorry, a quarter of the time less to do it in.
Wow.
And these programs are designed so that if you haven't done a PhD, at that point you hopefully step out, you get your own grant, and you use your research time in your junior residency to develop a PhD project, which I did. And so then I stepped out, and at that point you have to step out of training because you can't, I mean, I don't know how you guys do it, but certainly, I couldn't have enough time to do a PhD alongside being a full-time surgical resident. So I took 3.5 years out to do a PhD. And that's kind of how OHDSI jumped in, and that's how I became part of OHDSI, because that also coincided with the pandemic for me. So, my PhD took on a little bit of a different flavour, because I was doing that, and then I also got called back. Everyone who was out in research at that point in Oxford got called back in to work on the wards. So I was doing, I was back doing COVID relief work at the same time as doing some OHDSI COVID research. And then I went back to full-time clinical training last September, having completed my PhD. And for the past year, I've been a full-time surgical resident again. But that's how I then applied for what is a kind of senior residency program, academic senior residency program, where I'm 50% academic and 50% clinical.
Okay.
And so now I'm getting towards the end of that training. I'm now taking more dedicated time for my research again.
And so just to dive into that a little bit, you said that, part of the reason how you knew that this was a career that you're interested in is because you were meeting patients and you felt like you were curious to know the answers to questions, and that's kind of what got you interested in the research. So I guess, to dive into that, how did you know that being both in medicine and academic was a good career choice for you? And maybe for, some of our early stage researchers, how should they figure out if this is a career for them?
I think I was curious about it, so I knew I was doing research outside of my full-time clinical job, and I knew I wasn't able to do the kind of studies I wanted to do. So because I didn't have time, I just didn't have enough focus, and I couldn't meet full-time researchers because during the normal working day I was on the wards, I was in the operating theatre, so I just couldn't meet those people. So I thought, I need to try it out a bit more, and that's why I went for the job where I had 25% of my time. And at that point I thought, I want to step out and I want to do a PhD, because I want to have a really nice set amount of time to really dedicate myself to some research and really get stuck in. And I think I don't think I realised before I started my PhD was it's very much about you asking the questions that you're never going to have time to do again, or really learning and becoming an expert in that tiny area that you're never going to have time to do again.
Yeah.
And some of my colleagues have done academic clinical fellowships and have decided it's not for them anymore. Some people have done PhDs and gone, I never want to do that ever again. I'm going back to full-time surgical residency, and I want to be in the future, I want to be an attending who is purely clinical.
Okay.
Whereas for me, I still really love the blend of the two. So ideally in the future, I want to be a surgeon that has an academic and a clinical part of my job. And so that's why I want to dedicate some more time to my academic work alongside finishing my residency, because I need to see if it works blending it. Because it's very easy to go, okay, I'm taking 6 months out, or don't put me on the program for a little bit because I'm going to do research. It's very different to what I'm doing now, which is where I'm saying half the week I'm in the hospital and I'm doing all the shifts as everyone else, and the other half of the week you'll find me in the university. I'm talking to epidemiologists and data scientists and you guys, and how do you make that work? Because if you're going to be a long-term academic clinician, you need to be able to blend it together simultaneously.
Okay.
And so that's what I'm really trying out at the moment.
And so you went to medical school, you got a PhD. How do you think that that education helps you or relates to the work that you do today?
I mean, it's the basis of everything, really. You know, my medical school was the basis of my clinical training, and my PhD was the basis of my academic training. And now, having come out of that, I realise it really is about training.
Okay.
And now I'm stepping out into doing things that are independent, and I'm trying to lead other people, supervise other people, and that's where you build on what you experienced in those two settings.
And so you also talked about how, you got involved in Odyssey more recently.
Yeah.
Can you talk a little bit about that experience and how that has been?
So my PhD, I wanted to look at different types of routinely collected data and just see how we can use it for surgery. So, there's a lot more in the medical side of things using big data, and surgery is in some ways slightly behind that. I had always planned to think about an international collaboration, and I looked at different ways of doing it. Then, through my PhD supervisor, who is Danny Prieto Alhambra, and so this is mostly Danny's fault, basically, had said, there's this network of people, and the more I read about it, I thought, oh, this sounds really exciting. And this was in 2019, going into the new year of 2020. So I developed a research question so my clinical interest is in hand and wrist surgery. So my clinical question related to women who have breast cancer have a hormone blocking drug.
Okay.
And if that estrogen blocking drug causes them to develop hand and wrist conditions more in the future, because other parts of my PhD looked at the role of estrogen and changes that women go through during their life course and how that influences them developing orthopedic conditions. So I started setting this question up. I went to the Barcelona studyathon, which was on rheumatoid arthritis, because I wanted to see what a studyathon was. I met some people in Barcelona because at that point we were all still traveling. I was developing my question, and then we were meant to be hosting the European Symposium in Oxford in 2020. And then it became quite clear that that wasn't going to be able to happen because no one was going to be able to come to Oxford. And also, I think the more we heard about it, the more it became clear that this was a big deal and COVID was going to be a big problem. And I really remember it quite well. I was doing some research on another part of my PhD. So if you want to use NHS data about admitted patient care in the UK, there's this quite crazy situation where you have to have it on a hard drive in a locked room in a secure environment. So I was sat in this bunker doing my stuff about women with carpal tunnel syndrome, and I came out, and Danny had sent a message to us all saying, "I'm really sorry, I'm gonna be jumping out of the normal work that we do because I need to focus a little bit on COVID. We've made a decision that we're going to move our symposium into a COVID studyathon, and anyone who wants to get involved should get involved." And I just had that moment of, oh, I'm here looking at women with hand osteoarthritis. This is a very small issue in comparison to a global pandemic, and just the noise of the pandemic for me was just so great. And I could see it also from my clinical colleagues. I could see what was happening, and we were being told, you're going to have to come out because we're sending some of your colleagues to ITU, and then we're going to need some more people to operate because trauma, of course, never stopped.
Yeah.
And if anything, trauma increased a little bit because of mental health problems. We had more people doing slightly more risk-taking behaviour, and kind of there was more suicidal intent, things like that. So we were quite busy from a trauma perspective. So I knew I was going to be pulled back onto the wards, and I thought, you know what, I just need to step away from my PhD for a little bit. And so I messaged Danny and said, yeah, I'm in. I want to be part of this studyathon. I think we need to do this. And so at that point, because I was quite inexperienced in Odyssey, he said, right, okay, can you lead a systematic review? Now, this is something that I've done before. I've done quite a few systematic reviews. I was like, fine. So we just did huge systematic reviews. We had like 50, 60 people all across the world doing that. So I led that and I took that forward. And then as things became clear, you know, there were quite a lot of parallel work streams. So people doing characterization, people doing estimation studies, people doing prediction studies. And my interest was always in estimation.
Okay.
And they were like, right, okay, well, do you want to help us lead one of these? And I was like, absolutely, yes. Essentially, the stream of events was mostly me saying yes.
Okay.
And I was like, okay, well, this is quite daunting. And I'm going to keep saying yes. And at some point, it will become clear if I can or cannot do this.
Right.
But I'm just going to keep saying yes. I'm going to keep trying really hard. And then may come a point, a ceiling where I say, I can't do this anymore. It's too complicated or I don't know what's going on.
Okay.
But that actually didn't happen, if that makes any sense. I kept running with the pack. I thought, okay, so it's a bit like you have your pace setters if you want to run a marathon. You know, there are people who, when you run a marathon, there are people that say, you know, I'm going to run it in 3 hours, and you just need to run with me to finish a marathon in 3 hours. And for me, that period of COVID Odyssey work was me just kind of trying to run with the pack. And the pack were this incredible group of people from around the world, from very different backgrounds to me. And I just thought, okay, you just keep running, you just keep doing it, you keep producing what you think you need to. And I got direction from them. I was, you know, in an incredibly fortunate position to have all the people that you have in Odyssey to guide you. But I just kept going. And I thought, okay, well, we'll see what happens. And then, we got the study, and, you know, it became part of, you know, the story of Odyssey and COVID. And so that's kind of, And
that's just so inspiring.
It wasn't anything to do with being an orthopedic surgeon. And it was a very strange time. So I had to then go back to being more like I was in my junior residency, because I hadn't got academic time, because they said, right, okay, you will need to leave now, and you need to come back from tomorrow morning from 8 a.m. So I was operating and doing all of that. Then I was there were a couple of times I remember we had daily calls. And actually, if you meet people at the symposium and ask them, because I would be there in the coffee room in my scrubs waiting to scrub for the next case. And I'd be finding out what was going on, or I'd be like, I'd be trying to join remotely to try and keep up and in with it. But it kept me going as well, because it was a very challenging time to be a healthcare worker. And I think especially, you know, I remember thinking about the VTE question. So when we started looking at, is there an increased risk of venous thromboembolism? Because we were seeing an increased number of people die from pulmonary embolus or deep vein thromboses related to them having COVID. And so again, it was that time where I was back in work, but I was also researching about COVID. And so I would also be able to reference and think about the patients I was dealing with at the same time as going back to the group and being like, oh, you know, I think this is a really good question, or this is coming up for us, you know. So it went back to the reason I do all of this, which is that blend of the two, because your patients inspire you for the questions, and then it also keeps you grounded, because you go back the next day and you speak to your elderly nana, or, you know, you talk to the people you're doing it for, and you're like, that's why I do this. And it reminds you that, you know, it reminds you to be humble and to just keep remembering why you're doing it.
Yeah, what I'm hearing and what I think I really love is that it seems really interdisciplinary. And so I'm curious to know what your perception is of, like, the relationship and importance of physicians and other members in Odyssey. And I guess, in other words, what do you see as the role of, you know, physician researchers in the overall global community that we have?
So I think there's a really great diagram. I need to find it for you and send it there. There's a really good book that I read, and it's about, you know, when you have a team of people who are so very different, your overlap of your expertise means that as a hive mind, you have so much more to offer. And I think that's probably what we bring. I think in a slightly jokey way, I always feel as one of the physicians that my brain is a lot smaller than the majority of the people I talk to. And what they enable me to do is to access analytical processes that just wouldn't be possible for me, and tools and diagnostics that I wouldn't be able to do on my own. So that's what I get from them. What do they get from me? I don't know. Maybe, yeah, I don't know. Probably you have to ask them. I feel
Yeah.
I'm not sure. What do I bring? I do bring the clinical questions. So
Right, absolutely.
For my aromatase study, so the women with breast cancer, I remember talking it through to people, and they were like, "What is this? Is this a thing?" And so from that perspective, I think you can bring a relevant question, and you sit at that interface between all of the surgeons who are doing everything, you know, all the clinical work every day, who come to you with things, and then you can kind of, yeah, so you're sat at an interface maybe to enable to think about the clinical relevance, I suppose. Yeah,
That makes sense. I mean, I definitely see value in what physicians bring to Odyssey, which is, you know, why I want to go into medicine as well. So
yeah. But sometimes I do feel like the poor relation. I do wonder, like, what are you bringing here? But I think, yeah, I suppose the other thing I would bring, but I think this is more of a surgical mentality, is this idea of driving it forward and finishing. So sometimes I think people who have more of an analytical mind are really interested in the process and refining it and making it as best as it can be. And you need that. But also, as a surgeon, I'm like, right, so is this finished now? Are we submitting this? Like, where is this? You know, and that is part of a personality of being a doer. You know, and what you have to do, because we have to make quite finite decisions. And so I suppose that's the only personality trait I'd probably bring, is this, like, okay, keep pushing. And I think sometimes
keep pushing this forward.
Yeah. I think sometimes that's probably really annoying, because you want it to be the best it can be, and sometimes you have to slow down and stop and pause it. And so I am more slow down, pause, what's the question, how's it going? When my clinical colleagues come to me with something and they're like, yeah, let's push out this research question, and I'm like, hang on, let's pump the brakes, you're nowhere near. And then I think I'm the equivalent of that to all of the main Odyssey people. Yeah.
What kinds of things do you think, like being both a physician and researcher, demand of you that maybe a career like being only a physician or only a researcher might not demand? What do you think is, you know, added on?
It feels a bit like, now my disclosure here is that I only speak one language very well, but some of my colleagues have said, you know, it might be like trying to be a bilingual child. So if you're growing up and you're trying to do something in both languages, and you're growing up learning those two languages, at one point you're better in one language, and then one point you're better in another language. And so sometimes I feel like, yeah, I'm really driving forward in my academic work, and then I'll come back to clinical work and I feel like, oh, you know, am I benchmarking against my peers? How am I doing? And then you go back to academia and you see your colleagues who are full-time academics, and you think, oh gosh, am I keeping up with them? And so I think you're constantly trying to balance the two, and you're training in two things simultaneously. So your brain is constantly having to be agile in thinking about two things that are happening as a process, which is why sometimes it seems easier to go, okay, for the next 6 months, I'm doing nothing clinically, I'm going to do academia. But my worry about that is, and especially in a apprentice style subspecialty like orthopedics, if I don't operate for 6 months, that's not very good, because it's a skill, and you know, you need to keep doing it as well. So what I'm really trying out at the moment is a proper simultaneous blend, and academia is more open, I think, to not being there the whole time. A surgical specialty, especially something like orthopedics and trauma, is still in its infancy with dealing with trainees who are training less than full time. So someone who isn't there every day, all of the time, they struggle with as a concept. And we're getting there, and they, you know, I'm in a really great program and everyone is very supportive, but it's still very new and very unusual to do that.
And so to go off of that, how would you advise someone who is a physician to get involved with the academic side if that's something that they want to do?
I think it depends on where they are in their types of their training. So as in, where are they in terms of their clinical training, and where are they in their academic training? Because in some ways, doing a PhD and stepping out of your program for a period would give you the academic training that you need. But it's a big outset of time. So my colleagues that I started residency with are now attendings. They're very settled. They know where they're going to be for the next. In the UK, certainly anyway, you get your consultant job, and normally it's expected that you're going to stay there for the rest of your working life. So, you know, their life and their life course is settled. Whereas if you're going to step out and do something academic, you're investing a time of your life when you've got lots of other life things happening to slow yourself down on that process of reaching the end. Now, maybe reaching the end isn't the nirvana that everyone thinks it is, but you know, that security, that process, you're having to slow yourself down a little bit to do that. Right. But it depends on how much people want to invest their time, really, you know, and where they see themselves in the future. Because if you think you're going to be a full-time clinician in the future, it may be that you just want to do things outside of that, or you want to do a master's program or something like that to give you a little bit more, so you can be part of research whilst you're a clinician.
Right.
But you might not be leading research.
Okay.
You might not be, you know, applying for the grant, writing the question, you know, kind of leading that work in whatever area it is. So I think my first question to anyone who would come to me asking that is, I'd really want to drill down into where they see themselves to know how much time they should invest in it and exactly how they should invest that time.
That makes sense. And do you think there's a good starting place in Odyssey for that, or have there been any particular working groups or resources that you would point people towards, or people, or you know, just in general?
So I really love the study-a-thons. That's probably my surgical personality, because that stuff gets done. So I think the study-a-thons are really good for absorbing yourself into a community, meeting people, lots of different people, and you know, also some of the hackathons as well. You know, that kind of thing for me is really where you get inspiration. I think there's a lot of really good educational resources. So for us in Europe, as well as everyone else, you know, the Eden Academy has a huge amount of resources that you can do in your own time. And as we know over the symposium, you know, there's a whole Saturday tutorial on phenotypes and, you know, all of this. So I think that for me is where I've been inspired the most, because you see a breadth of people and a kind of variety of expertise. I am a lurker in the forum. I'm not a big forum person. I find it quite daunting, but I know I think some people do like the forum. And the working groups are smaller. I think for me as a clinician, some of the working groups are more methodological, and so are not quite as relevant to where I see myself, because I see myself in the Odyssey community as being able to offer the clinical application rather than being able to drive forward all of the development of the methodology and things like that. So the working groups that are more clinical.
That's really helpful. Yeah, and for someone who might want to lead a study-a-thon like you did, what's a good way to do that?
I think there's quite a lot of groundwork to do beforehand. So you've got to really think about your question. And then you've got to think about, well, do I have any data myself, or am I going to need everyone else to bring data? Are there people I can collaborate with who, I think you've got to make yourself like a little core team of enthusiasts who buy into your question and think it's a good idea. And then from there, you can do quite a lot of pre-prep. So I think if you want to do a study-a-thon, it has to come with a lot of organisation beforehand. But that's where there's a lot of expertise in Odyssey to do that. Right. So you've just got to get a core group of enthusiasts. And because there have now been more study-a-thons, there are more people who know how to do it nowadays. And there were, you know, now it's 2022. How many study-a-thons have we had since? There's a huge number of people because there are so many people involved in stuff over the last 2 years.
Absolutely.
There's a lot of people now, and there's new emerging centres where network studies are being run from, and that's really exciting.
Mm-hmm. And what about maybe skills and technical things that might be helpful for someone coming into Odyssey? What are some skills that they should maybe keep in mind or try to pursue because it'll help them in the work that they might find themselves in?
Gosh, that's a good one. I think skills-wise, there are two types of skills.
Okay.
Because there's the actual methodological analytical skills. There's the communication skills, and by that I mean how are you going to make what you've got as an output into a meaningful thing you're going to disseminate. So are you going to present this at a clinical conference? Are you going to present it at a more academic conference? Do you plan to make it into a paper? And I think one of the hardest things we always face is we have a huge amount of information and it's incredible. But unless you really know what Odyssey is, it gets sent to peer review and you get a lot of people who are very, very confused. So I think communication skills in distilling down, what was your research question? What really were your findings in the billions of people that you ran it in across your global network? So the communication skills of dissemination are important.
Okay.
The analytical skills or the methodology of how are you going to make your question? Because again, you can point and click on Atlas to your heart's content, but it might not be right, got to do that. And then the other thing is the skills of being a collaborator. And that is, again, about personality a little bit, but you really have to think about how are you going to get buy-in from people? How are you going to make it worthwhile for them? Because now, as everything snowballs, there's more people asking you for your time or to be part of a project. And why is someone going to choose your project and not someone else's? So I think those are the sections of skills I would go to. So it's not all just how good are you at thinking about your question. It's the two things on either side I think are the hardest.
Paul, did you want to jump in and ask some questions as well?
I did. That was really great. I enjoyed that. And I guess one of the things that struck me a little bit was how important it still is in 2022 to have good mentorship. I'm trying to think of, how would you have done this without Danny to help guide you in this process? And so my question is actually to Faiza a little bit. Is I was hoping you would describe some of the things we're trying to do to try to help. I think it's really important as any person in Odyssey to choose your mentors and find people who can help you take the next step in your career. And so I was hoping you describe a little bit some of the efforts you're trying to put together for our Odyssey conference around mentoring.
Yeah. Absolutely. Thank you, Paul. And I absolutely resonate with that. I think like Mark Suchard has been my mentor through Odyssey, and so I am where I am because of his support too. So yeah, I think first of all, the Early Stage Researchers Working Group is trying to put together a Meet the Mentors event, which we are going to be holding during the Global Symposium on October 14th. So we are bringing 8 mentors, which are Odyssey veterans or Odyssey leaders who have had a successful career in Odyssey and who are excited to share their knowledge on, professional journeys and how to find a job and just any questions that junior members might have. And I think it's also just been so great to have Asya Golazar on our previous career speaker event, and now we have Jenny Lane. So we're hoping to continue this as a monthly event as well. But I guess I completely agree with how important mentorship is. And Jenny, I wonder if you have anything to add on just how that has played into your journey to where you are today as a physician researcher.
Yeah, I think it's really, really key, isn't it, getting that mentor? And I think probably for me as well, I don't know whether I formally said, like, are you going to be my mentor? I don't think that ever really happened, but I have those people, and I have those people in surgery as well, and they're my sounding boards, people that I talk to about situations. And I think they are really key, and they aren't necessarily people who are the same as you. I think, yeah, they can have very different personalities from you as well. But I think that's one of the incredible things about Odyssey. I would have loved, like, obviously, this is the first, I don't know whether we've spoken about it, this is the first time I've ever been to a symposium. I've been to a study-a-thon, but I've never been to anything in person before. So the idea of your Meet the Mentors thing, I mean, I'm still excited now, and I've done a little bit in Odyssey. I think if I was coming at this in, you know, the 1920 year, I'd have been like, wow, that's incredible. So I think a lot of people are gonna really enjoy that. And you know, it's a nice way, especially if you feel a little bit overwhelmed, because I'm not sure I would go up to people independently and be like, hi, so here's me, I don't know anything really about Odyssey, but I really want to hear what you've got to say, can feel quite overwhelming. So enabling that as a way that people can sign up and breaking down that barrier is really cool.
Yeah, it can really be hard to find. It can be very hard to ask if you want to be my mentor, or if you are willing to be my mentor. I think it's a great way of you start by asking questions, and then, you know, I do think it's really incredibly important for our field to. I guess the other side to mentorship is I think you've chosen some phenomenal mentors, and you are clearly a brilliant person, doing academics and clinical care. And I think a lot of your value is being a bridge. I myself think of myself as an ambassador bridge between IT and informatics and the clinical world. And I think, you know, a lot of the value is in bringing those two people, those sides together. But I guess the question I have for you is, even with, you certainly can't do it all. There's just too much going on within Odyssey. So I guess, how do you build your team virtually? Or, you know, I can ask, you know, who do you go to for your study design questions? Who do you go for data munging or processing? You clearly can't do everything. So how did you help build out your team to help you do that?
Me, yeah. How did I do it? I think I'd only met people online and via email. And so I got to catch wind of quite quickly who was okay about working with a clinician who was new, who was okay with working with a newbie who's going to ask a stupid question. Actually, I think out of Odyssey in general, people are happier than in normal life or surgery about people asking stupid questions. Not because people are just generous, but also because, you know, you ask a stupid question for a reason, and sometimes it offers the biggest, you know, the biggest resource. I think. Do you want me to name names? I'm going to call them out.
I definitely wanted you to name names.
Okay, so I think it's not just about having mentors. I think it's about having allies. So my homies,
I separate that. So I separate that. Mentors are guiding you. Allies, I call team members. They're part of your and part of it is we are multidisciplinary. We cover a lot of different ground. And the reason we ask stupid questions is because I may know a thing or two about informatics, but boy, do I need help on the clinical side, you know. And so it's really important, or, you know, or the statistical learning side, or some of the analytics side. So you're going to ask stupid questions, even if you're an expert at one of your pieces of the puzzle.
So, I mean, it's great that Ross has just shown up. I would put Ross in my ally. I don't really understand prediction. And I didn't use prediction. I didn't do, you know, as in I came into Odyssey from that causal inference side. So estimation was where I knew stuff. And, you know, if I wanted to ask about prediction, I'd ask Ross and the guys at Erasmus, for sure. In terms of my sounding board for really stupid things, it would be Kristen Koska, Ed Byrne, who has heard a lot of my stupid thoughts, and Jamie Weaver. They're my kind of people who have really helped me out and really listened to the stupid things I've asked.
So I guess they could be kind of the wayfinders, but were those the folks who also got work done with you as part of your team for accomplishing your network study?
Yeah. So those were the people. So, Kristen had a huge amount of expertise in terms of data, how it's structured, how you physically, the nuts and bolts of getting it done. Ed was my my estimation guy, but also kind of me really thinking about the question, how do I put the question together? And then Jamie's the ultimate brain in getting hydroxychloroquine over the line. He was the guy that was crunching it and then pushing it to data.odyssey. And, again, there are things that will always stick with me. There was a morning, because it was my morning and it was him in Toronto at 2 a.m. and he pushed forward some results and he was like, guys, you need to look at this because there's excess mortality. And I was just sat there on my sofa with a coffee and I was like, oh, goodness gracious, like this needs to get out, and so that, there are definitely moments with that. And then Danny for me is about the communication dissemination and helping me distill my clinical thought into a research question, and then how we communicate that out. I mean, there are, the real titans, are people like George Ripsack, who knows how to distill a question, Patrick Ryan, who knows how to distill a question, and also Mark Suchard knows how to communicate it out. So there are just all these people who are playing their parts, and I suppose I was brazen enough to ask them, and I was lucky enough that they didn't say no. So I think not everyone, and again, if I was going to ask a really technical question, I'd go to Martijn Schumi and say, right, okay, can you tell me just a little bit about this? Yeah, there's so many people that I ask little bits about, I think.
Yeah, I think there's experts that you go to for questions and guidance, but I'm also trying to think of, who, and I think you also mentioned this, who's actually carrying water, who's going to help you do the analysis, like you mentioned, with Jamie at 2 a.m. And so I kind of think, I think of my close team as the ones that you're coordinating with on a daily basis in terms of actually executing something. And then, of course, there's definitely the Georges and the Patricks out there for asking some of the harder questions.
Yeah, absolutely. And I think the way I think about those, that core team, as it were, is from the outset, you're all in it and you've all decided that you're happy with the question and happy with the methodology and the way it's going. And so you're all on that, you're all in that process together. You haven't brought someone in at the last minute to say, oh, I've already made this protocol and I've already made this. It's as if from the outset, yes, I would bake a lot of it together, but you then want people to be in right at the beginning to help shape it, because what you don't want to do is find that there was an issue at the end and then you've come back and found it and then you're like, oh no, which you wouldn't. It's a blind spot that I had, but one of my allies wouldn't have had that blind spot because their expertise is different from mine. So I can look through a list of, it's the same, the other way around. People be like, oh, here's a list of negative control outcomes that have been made by the data. And I'll look through that and I'm like, well, that's not a negative control outcome because clinically I know that has an association. So that needs to come out. So I suppose that's how you gel. You have different things to offer.
That's right.
Jenny, just to pivot a little bit, I'm curious to know, do you still see yourself like maybe 5-10 years from now balancing both the medical and research side, and maybe to what extent on each end of those things? I know right now you said you were trying to keep it 50-50, and I'm just curious to know what you envision.
Yeah, that's what I hope for. And that's why I've taken this 50-50 job. And ideally, I want to leave it at 50-50. I think only time will tell how that works out, but on both sides. So, academia is incredibly competitive. You've got to get your grants, you've got to be able to supervise and get your team, and you've got to be able to, generate evidence. So you've got to be able to do that 50% of the time. And then on the surgical side, I've got about 18 months full-time equivalent before I'm fully qualified. I've done my board exams, I've done all of that. And then as a surgeon, what am I going to do? Now, some of my clinical colleagues do all, they have a wide-ranging practice. Now, I've already come to terms with, I'm not going to be able to do everything like they can, because if they're operating twice as much as me and their full focus is clinical work, they're going to be able to have a much wider scope of expertise than I am surgically. And so what I'm trying to establish is whilst I'm generally trained now, in my later life, I will have a smaller area of clinical expertise that I'm in terms of the procedures and the surgeries that I'm doing, but that will marry in with giving me time to do the academic work. But you've got to be somewhere that's going to be happy for you to be that colleague, and that's what that's what I'm looking for, and I'm seeing how it's a fit, because you need to be that colleague that offers something different to the department. So whilst you're not there doing twice as many shifts, you're there, just supporting the department in thinking of how they want to ask questions and generating evidence, and you're that different member of the department. Not every department wants that, but we'll see what it holds. And the reason for taking this job is a real acid test in seeing whether I survive it, because it, as you say, it's competitive, and go for it, jump, and or as I said, the analogy earlier, you run with the pace setters and you keep running and see if you keep pace with the 3-hour marathon people.
Yeah, I think that's a beautiful closing, that to just, go for what makes you happy, and think about the ways that, one can be helpful and contributing to their team. I guess, is there anything else that we've not covered that you think people would want to know, or that would be helpful in their journey as an early stage researcher in OHDSI?
Suppose I'd just suggest that you're bold. And as in, you ask those questions, you reach out to people, and especially after COVID, even though I'm not necessarily a shy person, I feel quite shy. We haven't been out and we haven't chatted to people as much as we did before. We spent a lot of time hanging out with our close nuclear family, and I think now's the time to get out there, to really be bold, ask the questions you want to do, and just the time is now, because we're now already establishing new norms. After we finished the hydroxychloroquine work, I actually posted things in the Real Mail, which was the first time I experienced the US postal system and realized just how long it took to get to different people. There was a piece of art that an artist did in the UK, and she's a neon artist, and she wrote reset in neon tubing, and she stuck it on a plinth in loads of places, and so it just says reset. And for me, this period of time we're in now is a huge reset, and we're lucky to have that opportunity to reset what was happening before COVID and to drive it forward. So this is the time to go out and be bold and think about the ideal or optimal situation that you want to be in, because your opportunity or your chance to make that a reality, I think, is greater now than it was before. And we can think about all the negativity and the difficulties that we're facing as a world. And obviously for me in the UK, we've got a lot of things to unpack about where our country is going, but try and focus on that as a positive reset, and just put yourself out there, be bold, talk to everyone in OHDSI, because they're all a really inspiring, crazy bunch of really motivated people.
Thank you so much.
It gives me lots of enthusiasm, I think. Gives me lots of positivity.
Yeah. Thank you. Thank you for just taking the time. I think this has been really inspiring for me, and I think anyone who listens to this is hopefully going to learn so much about how they can get involved and how they can, navigate their career if they're interested in doing only medicine or only research, or a blend just like you. And maybe we can have you on again on one of these career speaker events, I think.
Yeah, well, I mean, everything's dynamic, isn't it? Everyone's learning the whole time. I'm learning so much all the time. So everybody changes. And I'm mostly excited about being in America. I got here, and I got let in. And I'm really excited to come to Symposium and actually meet you in person. So I've met Ross in person, but because we're luckily both at the Barcelona Studyathon before COVID hit, so we both managed to get to meet each other then. But otherwise, not a lot of people have met. So I'm really excited about this week. I think it's going to be really cool.
It's happening so soon, so I'm definitely looking forward.
Yeah.